Well, good morning, everyone. Today we are starting a new session of the Legislative Assembly with the introduction of the 2021 Speech from the Throne. And this throne speech is about building a better province of Saskatchewan, a stronger, a safer, a healthier, a more educated, and a more independent Saskatchewan. And of course, our most immediate priority continues to be the COVID-19 situation here in this province. But the Speech from the Throne is an opportunity to focus on our important priorities for our province and for our government. Over the course of this upcoming session and in the years ahead, our government has always believed that a strong Saskatchewan always does begin with a strong economy. A growing economy creates good jobs and it creates opportunities for Saskatchewan people both today and tomorrow. And most importantly, it provides the resources that we need to invest in the important government services that improve the quality of life for everyone that lives here. There is much reason for optimism in this province. The throne speech outlines how even in a very difficult and yes, a challenging year, likely our most challenging year, we faced a pandemic as well as a province-wide drought. During that time, Saskatchewan has attracted over $10 billion in new projects that will create thousands of jobs. If we can attract that kind of activity in a year as challenging as this, our potential is almost unlimited as we look to the years ahead. During this session, we will build on that economic momentum by enhancing the Saskatchewan value-added agricultural incentive, by providing financing to Indigenous businesses that through a new Saskatchewan Indigenous Investment Corporation, and we will launch a new Sustainable Saskatchewan brand to promote environmentally sustainable products that are produced in this province and delivered abroad. The Speech from the Throne also has a significant focus on reducing crime and community safety. It's been said that the certainty of being caught is a vastly more powerful deterrent than the punishment. We want to provide criminals with that certainty. If you commit a crime, you can be certain that you will be caught. Property crime in particular in Saskatchewan is an increasing problem, in particular in our rural areas, because there simply isn't enough police officers and police presence to cover the vast rural areas of this province. This throne speech outlines a number of initiatives designed to crack down on crime by increasing that police presence, targeting known offenders through stricter enforcement of outstanding warrants, and ensuring that offenders are prosecuted aggressively and to the full extent of the law when they are arrested and ultimately charged. We also understand that the root cause of crime is all too often addictions, and that we need to do more to treat those with addictions in our province and to help them find a pathway to a better opportunity. So we will add an additional 150 addictions rehabilitation spaces over the course of the next 3 years, both through spaces that will be provided directly by government as well as through partnerships with charitable community-based organizations and as well as other providers. This throne speech also includes a significant commitment to reconciliation in the province, which has taken on an added meaning over the course of this past year with the discovery of unmarked graves at sites of former residential schools throughout Canada, including in Saskatchewan. And as I said, that includes the 751 unmarked graves at Cowessess First Nation. This throne speech outlines a number of important steps towards reconciliation through partnerships with First Nations, including giving First Nations greater control over child welfare. It also outlines economic partnerships with First Nations communities and Indigenous people in areas like forestry and gaming. In September, First Nations and Métis employment in Saskatchewan reached an all-time high. This is success that we can build on in this province. There are many other important initiatives and pieces of legislation that are outlined in today's speech from the throne, and there will be new legislation that will be introduced to further protect against workplace harassment, for example, and to provide better enforcement of child and spousal maintenance orders. And we will create yet more childcare spaces. We will continue to reduce the cost of childcare and we'll increase wages for childcare workers. We'll continue in this province to invest in infrastructure, building schools, building hospitals, building highways, building communications networks that are required for a strong and growing province. These are just some of the initiatives that are outlined in our speech from the throne, and I'm not going to go through all of them, but I will say that this speech from the throne lays out a very ambitious agenda for this legislative this legislative session for this government and for the years ahead. And our goal is to build a stronger, a safer, a healthier, a better educated, and a more independent Saskatchewan. And Saskatchewan people, as we know, our best days most certainly still lie before us. So I'd be happy to answer any questions if there are any.
You outlined the pandemic and COVID-19 as the most important immediate task that you have to deal with right now, which I'm sure a lot of people will appreciate. But maybe the people will be a little surprised that there's nothing leading towards more funding, more programming specific to that, beyond the veto money that I think you previously mentioned or previously had done. Why did you choose not to use this opportunity to sort of outline whatever financial commitments, whatever policy directions you might have in dealing with the present pandemic and the future problems that are sure to occur?
So, first of all, we're still in the pandemic, and as we know, Saskatchewan has been hit in particularly hard with the fourth wave of this pandemic, and so we have responded to that with the full support and the full response of the government. Most recently with the formation of our provincial emergency operations centre, which allows for a much more fulsome response of the entire government of Saskatchewan. And so, that funding that is required, whether it be in our healthcare, Saskatchewan Health Authority, or wherever that may be, has been provided and will continue to be provided until we're able to find our way through at least this fourth wave, and ultimately the goal is to find our way through the pandemic proper. Where we will be looking, and there are questions that government is asking and conversations that government is having around the capacity of certain services that we have seen stretched to their limit throughout this pandemic. For example, our ICU beds. We had a base of about 80 ICU beds here in the province. As we find our way through this pandemic, the question begs, is that the right number? Understanding that we will have a number of COVID patients that may be in those beds for a period of time. And we have a number of surgeries and other reasons, other pressures that have built up that we are going to need likely some additional ICU capacity. So as we move forward, we're asking questions as to what should that capacity be in the months, weeks, months, and years ahead. And then also, what ability do we have within our health authority to be nimble, to ramp that capacity up if it's required, to ramp other areas of potential capacity up within our health authority or in other areas of government if it's required. And so those are some of the conversations that we're having in government right now. And you may, and quite likely will, see the results of some of those conversations in the budget in the spring.
Can you elaborate a little bit more, because those are specifically the questions that have been being asked, the ICUs, the contact tracing, the systemic problems that we don't really have, that you now have fully identified, or the government has fully identified. What else are you looking at? What are you looking at in terms of the 79 ICU beds, in terms of increasing that? Are we looking at more use in terms of hospitalization beds elsewhere? Either converting what's happening in Pattison or elsewhere has had to be done. I guess what I'm asking is just more specifics.
I don't have those specifics, like where those beds ultimately would be, or ultimately even to what level specifically those beds may be. But those are the questions that we are asking right now. Is are we at the right number at the base 80 that we had? And what is our ability to actually flex that number up? And I use ICU beds as an example. There may be other areas of the healthcare system where we need to be able to be nimble as well. Contact tracing testing is another area where we have shut down a large number of services across the healthcare system to really provide that contact tracing and that testing capacity. We're now in transitioning, and in the days and weeks ahead, would be transitioning some of these folks back to the services that they ultimately were providing, and we want to get them back providing as soon as possible as we bring in some private procurement. For example, we have private folks that are doing testing in communities right across this province. We've seen that list grow even just this past week. We brought in looking for private procurement of some of the contact tracing that we're doing, which does free up some of the resources ultimately that we can that are not directly related to our ICU capacity, but are directly related to our COVID response, and try to get as many of those folks back providing the services in our healthcare system that they're just not providing today. With the ICU capacity, another example of being nimble there after, we may decide in the time ahead on, what number do we need to land on over the course of the next number of years as far as beds. But we saw, The ability, yes, to flex up to 125 and now 137 beds, but we also saw where the SHA had committed to flexing up to 175 beds in a news release just over a month ago, and we weren't able to do that, and for reasons that are very very real. But in years ahead, should we have the capacity and the folks across the healthcare system to be able to be nimble and actually flex up to that number, should it be needed in 3 years, 5 years, 10 years, whenever that may be. And so those are just a couple of questions, and I use the ICU capacity or some of the other deployments as an example as to how can we ultimately ensure that we are providing the correct services, and we are ultimately nimble enough to be able to flex up and down if it's required in the future.
But why are we still, asking questions and having conversations at this point? I mean, we still have a hospital crisis. We could face a fifth wave of the pandemic that will again cause the same sorts of pressures that we're dealing with now. So why not use this opportunity, this session, to introduce supplementary estimates, to hire more ICU workers,
We were doing all of that, Arthur.
But why not have that in the throne speech as a priority, something you want to do this sitting to get ahead of this problem before it comes back?
But if you look at what we have already been doing, we're doing all of those things that you had mentioned. We've requested help from the federal government. They provided us with 6 critical care nurses. That adds to the 480 that are working in our ICU departments today. We have 70 provincially trained ICU nurses that will be available in the literally days and weeks ahead, that we will transition then into our ICU setting to support those 480 plus the 6 federal nurses that are in there. And so all of that work is really the work of the Provincial Emergency Operation Command Center right now on where are the resources that we can attain and how do we transition those into exactly where they're needed. This was some of the work that was done as well in the in some of the patient transfers and some of the discussions that happened between Marlo Reynolds and some of the relationships that he had with other provinces around Saskatchewan, as well as some of the phone calls ultimately that I had, and with other premiers, but I would point to the ultimately where we did transfer a number of Saskatchewan patients was into Ontario, and we had given assurances to Premier Ford that we were going to utilize all of the provincial resources that we had prior to requesting the transfer. Now, for a number of days, we have been transferring patients, which means that our provincial resources are being stretched to the very limits in our ICU departments, and have been assured of that as recently as this morning. That being said, as we look out into the weeks ahead, our case numbers have started to break. We're down about 52% on our 7-day rolling average. I think we're down about just under 50% on our active caseload here in the province. And so, and our hospitalizations as well are starting to drop. Our ICUs are down as well due to some transfers out of the province, and we're hopeful that number will start to break as well in the days ahead.
Mr. Premier, you saw some modeling from June that's been released that showed that the 4th wave was headed where it ended up. What impact did that modeling, if any, have on the government's decision to do its reopen plan in July?
You're referencing the modeling back in June?
Modeling that's recently been released, which showed that the 4th wave could happen the way it did. So I'm wondering if that had any impact when you made the decision to announce the reopen plan in July.
Yeah, no, listen, the modeling all along is always does show, and it's dependent on vaccination rates as well as a number of other tools that are there. And the modeling itself is one tool that comes into, a number of the decisions that ultimately this government makes. And listen, we do look, and the Minister of Health and his officials, they do look at the modeling. They do look at a number of other of tools that they have at their disposal as well. So so that is part of the decision-making process ultimately. But ultimately, this government as well is always looking at all of the tools that we ultimately can provide to Saskatchewan people to keep them out of hospital. And we've always said that is the driving force behind the decisions that we ultimately are making. That's why we have dispersed a couple million tests across the province here in weeks gone by. That's why we have been one of the very first provinces to make monoclonal antibodies available to Saskatchewan people. That's why we have put in the health measures that we did in the middle of September ultimately.
One more, just on a separate subject. As you know, there's a camp that's sprung up in Regina, and some advocates are hoping that the government will go back to its old system. What can you say about anything that's developed on that recently? Is the province considering changing its payment structure to the previous structure, or are we going ahead with the plan as it's been designed? No,
we're going ahead with the plan as it's been designed. I think the Minister and the Ministry of Social Services, with respect to the camp specifically, has had officials that have been visiting that camp on a frequent basis to provide any government services that folks there may ultimately qualify for, and to walk anyone through any of the challenges they may have. We have services to offer. We have housing to offer, and we have social services employees and staff that are willing to help folks with any questions that they might have. But we're continuing to move forward with the plan as we see it. Just one on the throne speech. Policing seems to be a very big focus of this. What can you tell me about what your caucus colleagues and others have brought forward as making this the priority it seems to be with the creation of these new teams? And is this the start of creating a provincial police force? Well, there is the addition of 60 police employees across the province that we'll commit to in this speech from the throne. And when you look at the various very focused work that they're going to do, whether that's the warrant enforcement and suppression team or the trafficking response team, or adding to an already successful initiative in the crime reduction teams. They're very focused on addressing repeat offenders, drug crimes, as well as ultimately property crimes. This is what Saskatchewan people, and this is an example of other conversations that are happening in our communities across this province. COVID obviously is one of the part of every conversation, but there are other priorities that Saskatchewan people are telling Saskatchewan Party MLAs from corner to corner of this province as to what are priorities ultimately for them. We also understand that if you're going to make any moves, any initiatives on the crime reduction side or the enforcement side, you need to really understand and have a holistic approach as to why that crime is happening. And we understand that much of the crime that we see is addictions fueled crime, and so we want to ensure that those Saskatchewan people that are struggling with addictions, that we're providing them a pathway to a better opportunity. And you're going to see, as we committed over the next 3 years, the increase of 150 rehabilitation beds. Those will be intensive beds that will help folks that are may find themselves addicted to much more addictive substances than maybe we have experienced in the decades gone by in this province. These will be programs that are not based on how many days you're in the program, but based on your progression through the program. So quite a different rehabilitation effort, much more like what we committed to and opened in Estevan last year. You're going to see that expand out across the province over the course of the next 3 years.
But are you working toward a provincial police force?
Pardon me?
Are you working toward a provincial police force?
Well, what we have here is bringing through our provincial protective services unit, bringing all of our enforcement units, whether that be the highway traffic, the conservation officers, all of our enforcement units provincially under one enforcement unit. Really, what that will do is the first steps of supporting our municipal police forces that are operating, for example, here in Regina, but also supporting our RCMP services that are operating here in the province. There is discussion about whether a province like Saskatchewan should move forward with a provincial police force. We haven't had openly that discussion as to whether or not we would move forward with our own provincial police force at this point in time. But what we do want to do is look at the enforcement forces units that we have, municipal, RCMP, and a number of provincial officers, and how do we ensure that they're all working together as closely as they can to support Saskatchewan people and really provide the safest communities that we can.
Can you just expand on this workplace harassment matter? I take it that's aimed at the pro-life people that sometimes go to hospitals and the anti-mask people.
Yeah, with respect to an exclusion zone. Exclusion zone is moving forward on like a 50-meter exclusion zone around the entrances to hospitals and such, and that is strictly to ensure that, in particular in current times, those folks that are going possibly to visit a family member in the hospital that may have COVID, may not, it may have some other ailment. And in particular, the staff and the workers in our healthcare facilities just aren't having to walk through a line of protesters that are protesting against what is proven science, protesting what is really stressing them in the way of the hours that they are having to put in at work, and then also the conditions in which they are working under. And so it's an exclusion zone. It's just that, and it's to provide that buffer for staff that are entering our hospitals as well as families that are in to visit a loved one.
But not just COVID specific, it could be any cause anybody may have.
Right.
Thank you.
This speech has a tone of optimism, but optimism for who? Because it's certainly not for 11-month-old Helen, who is losing her ability to see or might not be able to walk. It's certainly not for Crystal, whose mortality rate is increasing to 50%. Or even our Chief Medical Health Officer, who broke down in tears yesterday as presenting modeling that he says is unchanged, that we're going to see increase in hospitalizations and ICUs. So who should feel optimistic about this speech?
Well, I think when you look ahead, let's look just briefly ahead to where we are in Saskatchewan when it comes to COVID-19. Our numbers are down. Our 7-day case numbers
Our hospitalizations remain fairly
I'd say our hospitalizations are down as well.
Not
no, they
much.
are. They're about 20%.
81.
No, they're down about 20% since their peak.
That's because we're shipping about 20%.
No. Our hospitalizations, not our ICUs, are down. The facts are the facts, and that's where we are. We're down about 52% in our 7-day average. We're down about 48% in our active cases. These are the facts of the province, and I think it speaks to the impact that the public health measures that the government has introduced are having on the people of Saskatchewan. Ultimately, we're hopeful now that the ICUs as well will start to drop in the days ahead. As we spoke earlier, we are transitioning in as many resources as we can to support those folks that are working not only in our ICU departments but across our hospitals here in Saskatchewan. And ultimately in the days ahead, where we feel that our numbers are going to come down to a much more manageable number. We're watching that very closely alongside with Dr. Shahab. We're introducing additional tools, as we said, that we have not in months gone by had in this province, and we're hopeful that none of those will have the full impact of being the solution, but all of those ultimately are going to have an impact ultimately on the hospitalizations that we have here in the province. So as we look ahead beyond that into the months and years ahead, I think this is a time for great optimism for this province. When you look at the investment that has come into this province over just the course of the last few months, it's record-setting investment. And that is going to create not only construction jobs and opportunities for people my age, younger and older, but they're going to create opportunities for people that may want to move here as well, as those businesses get through the construction period and into the permanent full-time jobs, whether they be a potash mine or a canola crush plant. Those are all new jobs to this province and new jobs to the communities in which and where they're ultimately going to operate. Now, government is mirroring a significant amount of public investment to ensure that we're not only able to attract those private investments and those jobs and that opportunity, but to ensure that we're also building communities that are safe and have the services that people that ultimately are working in those industries would like to move to Saskatchewan. We're building hospitals, we're building schools, we're upgrading our highways, we're ultimately investing in in safer communities, and yes, investing in ensuring that people have pathways to more successful opportunities in their life as well. And so I think the broader community, with the initiatives that are laid out in this speech from the throne, and I didn't get into the reconciliation and the opportunities for all of Saskatchewan people through our engagement with Indigenous communities, but the opportunities as we look ahead are great for Saskatchewan people. That's notwithstanding the challenges that we have experienced over the course of the last 20 months and the challenges that we're still finding our way through today.
I get that you're saying that, action is already happening in the background through the PEOC, which is obviously responsible for managing the pandemic to a large extent, but this throne speech is your chance to signal what your overarching priorities are for this session. And it feels, reading it, that COVID-19 really only gets a passing mention. It's obviously something that you view as a great concern, but there's really only one concrete measure here in the throne speech, and that's the hospital exclusion zone. So with all of the advice that you've been getting from public health officials, from medical health officers, I assume from Dr. Shahab, why were you unable to find anything else to highlight in this throne speech as a priority for dealing with the COVID-19 crisis?
I don't think any of what is happening with COVID-19 is happening in the background. I would say quite the opposite. All of what is happening and the decisions this government is making with COVID-19 are very much in the foreground. I think the PEOC committee, the Provincial Emergency Operations Center, is out speaking to media, I don't know, 2-3 times a week. The decisions that they're making are coming out by news release as ultimately they're being made, and that is the whole of government response that this government is committed to. And so the transitioning of patients from here to Ontario has not been happening in the background. The public ask of the federal government, and they're providing us with 6 critical care nurses, certainly not in the background. The 70 nurses that we have upgraded their training to support and augment the ICU beds that we have in Saskatchewan, most certainly not in the background. The monoclonal antibodies that are available, not in the background, as well as the couple of million rapid self-tests that we have provided out to communities across this province. And so I think COVID-19 has likely been one of the more transparent processes that government has seen, and is certainly as transparent as any other process that government has been through and will continue to be until we ultimately find our way through this. And there are some things to be positive about. Our vaccination rate since we introduced the proof of vaccination system is up 7%, both on first and second doses. We're at 85% with our first doses here in the province, and we believe that this government is making decisions to provide all of the tools that are available to us, and they're increasing as we go through time, to keep people out of hospital. The first and most effective of those tools is a safe and efficient COVID vaccine. There's other parties in this House. The opposition party is choosing quite a different path. Their first choice, where they're moving, and they've said this many times, is to increase public health measures on Saskatchewan people, on all Saskatchewan people, including the 85% that have made the right choice and went out and gotten their first vaccine, and likely are going to get their second vaccine in the weeks ahead. And so we are going to see, through this session, and likely into the winter, a divergent path of the reasoning behind the government's decisions versus where the opposition is going to be. There is going to be a divergent path there.
Why is all that a reason to not talk about COVID in your speech, though? Or in the throne speech?
We do mention the pandemic ultimately in the speech, and when you look at the speech from the throne, and we address COVID, the pandemic, virtually each and every day in scrums, like we are right here today. Where we are in the speech from the throne is ultimately putting forward some of the initiatives that we're hearing are important to Saskatchewan people, and by we I mean the entire government caucus, and some of the conversations that we've had with Saskatchewan people and communities, right across this province, whether those communities are Indigenous communities or otherwise. And you're seeing much of that being reflected in this speech of the throne that we've had here today, which really determines government's work not only over the course of the next year, not just the next number of months, but over the course of the next year, and ultimately really sets the foundation for the years after that.
Why is it taking so long for the Trespass Act to be enacted?
Well, that's a good question. And there's been some challenges, and I've talked to many folks about some of those challenges, and with respect to, some of the unintended consequences when you introduce a piece of legislation and pass a piece of legislation like the Trespass Act. For example, it has an impact on snowmobilers. Snowmobilers that are skidooing will need ultimately permission as they travel across land in this province. And so, we're just trying to work through and to ensure that we have the least unintended consequences as we potentially can. And, are there opportunities for us to continue looking at that Trespass Act, understanding there's challenges, in particular in rural areas, which is why it was asked for in the first place, with people that are in other people's yards for nefarious reasons. And so we're going to pass the Trespass Act, I believe, early in the new year. Or proclaim it, please. It's already been passed.
Is that part of the rural crime focus in the speech?
Well, I suppose it could be by its timing. The Trespass Act, as I said, will be proclaimed early in the new year. It does fit in with a number of the other initiatives that we have here with the Provincial Protective Services Unit, in augmenting and adding to our crime reduction teams, for example, the Saskatchewan Trafficking Response Team, which is really going to target, criminals that transport illegal drugs and weapons in and out of the province, or the Warrant Enforcement and Suppression Team, which is targeting those folks that have outstanding warrants, and we're going to find them and ensure they're abiding by the terms, the legal terms that they have enacted on them. So by timing, I suppose it could be, but we did want to look at the Trespass Act again, just in its entirety, as to ensure that we have the minimum unintended consequences on proclamation. But also, is there some opportunities to ensure that the Trespass Act may is as correct as it can be in providing landowners with the maximum amount of protection ultimately from those that may be in their yard to cause vandalism or to take things, and for those that may be in their yard sometimes more than once. And so there is another quick look that is being happening with the Trespass Act on those two fronts, but it will be proclaimed early in the new year.
This government mentions in the throne speech that it wants to address equalization. How will you support Alberta in that, and what's this government's plan for that?
Yeah, as we know, Alberta's done their referendum on equalization. I think it was about 62% looks like in favor. If that's not the official results, that's the ones I had saw. We have said from day one, whether it be in our Council of Federation calls or publicly, that we'll support Alberta, in opening up a conversation with the federal government about the equalization formula and pointing out as to, just in which ways it's not fair to Canadians as a whole, either on how it's distributed or how it's actually, it's collected in a relatively fair way, but how it's distributed across Canada. So there'll be more conversations about that ahead, but we will be supporting Alberta in opening up a conversation with the federal government, which is required now by the fact that they have done a referendum on it.
Why would anybody in the province take you guys seriously on this? People like me were sitting in this room 10, 12 years, no, I'm probably the only one, but we were sitting in the room 10, 12 years ago, listening to your predecessor basically say, we don't need this right now, we're going to be a health province forever, we're actually abandoning the formula we had in place that we were pushing for because it was being rejected by then the federal Conservative government at the time. Now we have a different government in province. In Ottawa, you're pushing this issue with something that seems to be just an all hat, no cattle promise of doing something that you really can't change. Why would we take you seriously that you guys really want to have serious equalization change when you abandoned it 10 years ago and when you're not proposing anything right now of consequence?
Two reasons. One, as equalization, the unfairness of the equalization formula has broadened since that point in time. And the second reason...
How's it broadened? It's the same formula as we had.
No. It's been changed twice since that period of time. And we see...
We still have the 35 points.
We see,
I don't want to go into this fight.
We see provinces like Quebec that are collecting billions more dollars than they were even back in 2007. The second point that I would make is this Alberta is leading this discussion with the federal government. We've always said we'll support Alberta through these discussions. We have led other discussions with the federal government when it comes to initiatives such as, the carbon tax that they had instituted on Saskatchewan people, and they ultimately have an offer for that to be collected now by the provincial government, and I urged them yesterday to accept that offer and to do it sooner rather than later. So as I say, we're not leading this initiative with the federal government. We will support Alberta in their initiative and the referendum that they ultimately have held, because even as we didn't pursue it, well, I guess it's 15 years ago now, even as we didn't pursue it at that point in time, I think it's fair to say that we still felt it was an unfair program to Saskatchewan. And that's saying something coming from a province that has been on both sides of equalization.
Well, it was unfair 10, 15 years ago, and it's still unfair. Why Quebec and Manitoba both are still collecting disproportionately more has a lot to do with the same problems that this government,
which have now been expanded,
identified 10, 15 years ago.
Which have even been broadened, and then there's a wider girth.
It's still about natural resource revenue extraction. It's still about hydroelectric reactions. It's still all about the same things that haven't been fixed in the last 10, 15 years.
Right.
And I guess I repeat my question. Why would someone take you seriously that you're actually planning on fixing it when the only time you seem to bring it forward was when there's a different government in power, and you seem to, as a government, want to abandon it when there's a Conservative government in power?
Well, I don't think we're bringing it forward. The province of Alberta is bringing it forward. They held a referendum. Absolutely, we're supporting it.
The province of Alberta is a Conservative
Pardon
government.
me?
Well, you're supporting it.
Yeah.
The province of Alberta is a Conservative government, and you're the only two provinces in the country that seems to be challenging it on that basis.
I think
right now.
Saskatchewan people would, by far and away expect this government to support it, and we're going to.
Well, they expected to support it for the last 10, 15 years, and you didn't. So
Well,
I guess the question is, why would they expect
They
it?
expect us to support it today, and we will.
You said that the things that you put out in the throne speech are things you've heard from people in the community, that these are their priorities. So does that mean that you're not hearing that COVID is a priority? Because there's really only a mention of COVID and what you're doing in maybe 1 or 2 pages of a 28-page speech.
No, we still do have, discussions about COVID, and it enters many discussions across the province. As we, and we are, providing, the fullest response that this government can, through the Provincial Emergency Operations Centre to, our COVID pandemic, both today, and I think you will see some strategic investments in the months ahead with respect to some of the, the questions that I had raised earlier, and I think you're going to see some of those come to fruition more so in the budget document that will come ultimately in the spring. But with respect to the speech from the throne, these are, a number of the other conversations that we're ultimately having with Saskatchewan people about, the economy as we move forward, and really, when you go into a community like Prince Albert, there is excitement with respect to the forestry investments that have been landed there, about $1 billion of forestry investment. When you go into an Indigenous community in and around Prince Albert, there's also excitement because many of them are actually participating actively as a shareholder in one of those particular forestry investments. And so, there is a very strong discussion about reconciliation, economic reconciliation, and opportunities for not only those in the PA area, but those Prince Albertan area, but those in Indigenous communities in and around the forest fringe. And so, that is an example of the conversations that I know our Prince Albert MLAs, Alana Ross and Joe Hargrave, have been having, as well as Fred Bradshaw, Jeremy Harrison, throughout that forest fringe. We have the BHP investment in the Jansen area as well. A very large part of the discussion in Saskatoon, as well as on the eastern side of the province. And you come down into Regina, and most certainly, the canola crush plants and some of the other commitments that are now being looked at in the way of carbon capture and private investments, I might add, are most certainly on people's mind. So, COVID is still important for everyone, including the government of Saskatchewan. It's still part of the conversations, and we still need to take it very seriously, in particular as we find our way through this fourth wave of COVID-19 in this province. But there are other topics of discussion and policy initiatives that people of Saskatchewan want to see their government working towards, and you're seeing much of that in the speech from the throne.
Provide any more context to this legislation. You say will protect every worker from sexual harassment and make Saskatchewan a leader in Canada in ensuring workplaces are safe.
Yeah, we're looking at legislation that's going to encompass just what it says. Legislation to protect those folks in all workplaces in the province from harassment. It's going to expand on some of the work that we've done in previous years.
And I guess on what grounds do you feel you can make a statement that this Alberta referendum does compel the government to come to the table with all provinces?
It's actually, it escapes me where it's, but there is it is part of, whether it's in the equalization formula, the Constitution, I just can't remember at this point in time, but there is a clause in there that when there is a referendum held on an item like equalization, it does cause pause for the federal government to engage in a conversation and negotiation around, not a negotiation, but a conversation around a program like equalization. And so that was the reason behind the referendum. I just don't remember where that clause was off the top of my mind, but we had indicated from day one that we'll be supporting Alberta should that referendum pass.
What is sustainable Saskatchewan and why is it necessary?
Sustainable Saskatchewan is, we've had many conversations with our exporting nations and customers around the world as to what's important to them in the products that they buy. And I would just go back to in Saskatchewan, we export to over 150 countries all around the world. Largely agricultural products, potash products, and timber products, as well as uranium. And increasingly, some of our exports are actually more on the innovation and knowledge and technology side as well. And so. One very important item, there's obviously the quality of the product, there's obviously the price of the product, but is how that product is actually produced and how it's delivered. And, Saskatchewan has a great story, whether it be on supply chain management and the stability of governance and regulatory environment that we have here, which is why part of the reason we're attracting the investment that we are into this province, mainly because of the people, but partially because of the stability that we have in the province because of the people, but also from an environmental perspective. When you look at the agri-food products that Saskatchewan produces, it's among the most sustainable in the world from a carbon perspective or from a soil, water, air perspective. When you look at the potash that we produce in Saskatchewan, the $20 billion that was invested in potash mines over the course of the last 15 years was, yes, to increase our production, to make that production more efficient, more competitive, but also to ensure that that production is more sustainable. When you look at our energy industry in Saskatchewan, our oil industry, if the rest of the world produced oil like we do in Saskatchewan, you would reduce global emissions due to oil production by 25% overnight. That is a statement in itself. Saskatchewan has some of the, yes, highest quality products, yes, most competitively priced products, but we have some of the most sustainable products in the world. That's what our customers in over 150 countries are looking for, and we want to ensure that we're providing them with a mechanism to ensure that they are buying sustainably produced Saskatchewan products, and that is what the Sustainable Saskatchewan Initiative is going to be about.
So there will be a set of standards that an
Yes.
exporter would have to meet?
Yep, there will be a set of standards, and there will be then a branding that you would be able to include in your ultimate products that are being produced here and then sold to other folks around the world, which is the source of our wealth in this province.
Can you just clarify that statement? Is it just oil or is it oil and coal?
For Sustainable Saskatchewan?
The 25% figure that you just cited, I'm
Oil.
just wondering if
Oil.
but not including the
No, it's oil, and no, just oil, and it is due to investments like we saw at Gibson's refinery in Regina that reduced their net emissions out of that refinery. It's due to investments that we're seeing in the northwestern portion of the province, the Lloydminster, Maidstone area, the thermal projects going in there where they virtually eliminate their methane emissions, which is much more problematic than even carbon, and reduce their emissions profile to a great degree. It's due to the carbon capture and enhanced oil recovery that's happening in Weyburn. We saw a memorandum of understanding with Federated Co-op and Whitecap in Regina here last week, but they've been buying carbon, yes, from our coal-fired power plant in Estevan. They've also been buying carbon from the gas-fired plant in North Dakota, and essentially in this province for years now, we've been taking carbon from the United States of America and sequestering it through enhanced oil recovery here in Saskatchewan. And so, we have a tremendous story to tell, and one part of that story is with our oil production here in Saskatchewan. If the rest of the world did it as efficiently and sustainably as we did, global emissions due to oil production would drop by 25%.
Isn't that all sort of being undone by what we do with coal in terms of burning? And I'm probably inciting a conversation on nuclear power. But
Yeah.
don't we have to factor that in as well and look at it in a more wholesome way in terms of all the factors that are contributing to our CO2 emissions that aren't going down?
And we are. And the federal government has laid out the plan to phase out of coal by the year 2030, or at least unabated coal, and so those discussions as well are happening on how we are going to lower our carbon emissions by either retrofitting our coal-fired plants with carbon capture and storage, ultimately looking for an enhanced oil recovery field to sell that carbon into, of which we have that opportunity in Saskatchewan, first with Whitecap, but likely with other companies as well, and that has precipitated, yes, the conversation that we're having around ultimately implementing small modular reactors here in the province, which have a much lower carbon footprint, and ultimately are going to be part of our carbon solution, not just in Saskatchewan, but likely across Canada and around the world into the future.
We've got time for a couple last questions, and we'll have the ministers available after throne speech too. So,
We've been talking about the decrease that we've seen over the past few weeks in case numbers, but those come amid similarly low testing rates that have gone down by a similar proportion. How concerned are you that that may be artificially low in terms of
testing is not down. Testing is not down today. Testing most certainly will be, and I can find the numbers, but with all of the private testing options that we have in communities that aren't dumped into the public numbers, the private testing options that people are taking, and the rapid self-tests that are available, a couple million of them in communities right across this province. Public testing numbers are down, but testing in general across the province most certainly is not down. Likely is up, and up substantially. When you look at other provinces, and I'll use Nova Scotia as an example. I think it was Nova Scotia, pretty sure it was. Their PCR tests were never open we're really coming into line with other provinces. Their PCR tests were never open to the general public. They were open to people that ultimately, I believe, had a positive rapid test or were symptomatic. That's where we've gotten to now in Saskatchewan. And so our public testing numbers are what they are. But our overall testing numbers, when you include all of the private tests that are happening, and you can see the list on the SHA website, and when you consider all of the self-rapid tests that have been dispersed to communities across this province, testing most certainly is not
Well, who
down.
has a testing positivity rate of 10 to 13% that we currently have? The doctors are warning you about this, and as per Arthur's question, it is deceiving to basically talk specifically about tests when we aren't testing and our test positivities are still up. You guys are being warned about that, and by, not me, but by CMOs across the province. It's a big problem. Why are you not looking at it from that perspective, particularly with the number of people we do have vaccinated? Because we're having higher numbers than we did in March of this year, if I remember correctly.
And higher hospitalization numbers. I was looking at, for example, North Dakota's hospitalization numbers. I think they have the similar or higher active case count, and far lower hospitalization numbers. And I haven't been able to square that circle as to why that might be, because my understanding is they have a lower testing or lower vaccination rate than even we do here in Saskatchewan. And so, at times there's some perplexing comparisons that ultimately can be made. I'm not discounting that our COVID rates in this province, even our daily COVID rates, as much as they have decreased, need to decrease further. They're still too high. No one's denying that our COVID infection rates are not too high. They need to continue to go down. We are happy to see the trajectory of those rates down 50% from our peak in just over a month. We're hoping that will continue into the future. If it doesn't, then we're ultimately going to have to consider, what our next steps might be. But to date, it has continued on this downward trend on the 7-day average, and that's a positive, and that speaks to the the effectiveness of the public health measures that are in place. We're trying to, and what we're attempting to do is to provide Saskatchewan people with all of the tools at their avail, so that we can in turn push down those hospitalization rates as well to the maximum degree possible.
Why not bring in additional measures for people who aren't vaccinated, so that we don't have to punish the people who are vaccinated?
Right, and we've seen some other provinces do that. Well, really, that's what our proof of vaccination or proof of negative test policy is in place for. yes, you can, and maybe we possibly would have to in the future. But right now, what we have in place is proving to lower our numbers and continue to lower them. As I said, they've been on a downward decline for just over a month now. And so, to answer your question, if those should stall at a level that's too high or start to turn and start to increase again, most certainly that's a discussion that we would have to have.
Where would you take them further? Would you take them to retail sales, places like that, for proof of vaccination?
Haven't had that
Would you
discussion.
consider it,
Yeah,
though?
what we are, and this gets back to the divergence in policies that we're going to see, throughout this session. We see a government that is trying to provide Saskatchewan people with all of the tools to keep them safe, keep them out of hospital. Number one among those is access to vaccines, and trying to impact Saskatchewan people's life to the least degree possible. And you see an opposition party that most certainly would go much further with public health measures and have an impact on all Saskatchewan people, including the 85% that have went out and gotten
people
one
that aren't
shot.
vaccinated be impacted more if this is the problem?
Oh, they are today.
Well, what about retail sales? That's what I'm asking. Would you consider having...
I'm not sure that is where the problem of transmission is, and that's where Dr. Shahab ultimately, and the conversations that we have with Dr. Shahab ultimately, if we should have to consider additional measures, that's where that conversation would come in as to where is the transmission ultimately happening, and what can prevent that. Ultimately, what has the largest impact on preventing it is whether or not you're vaccinated. You're 28 times more likely to end up in ICU.
I get numbers, but I just like to move this forward if at all possible. Then, would you consider the doctor's recommendation from the CMOs about limiting the gatherings of non-vaccinated people or partially vaccinated? Because that was in...
Yeah, if our case numbers, it was stalled at too high of a level, or our case numbers started to increase rather than decrease, that would be a conversation ultimately that we would have at that point in time. They're decreasing, they're continuing to decrease, so that's not a conversation that the government is prepared to have, as what the measures we have appear to be lowering the case counts. I'm sure we'll see a very different view from the opposition, who would ultimately like to enact a lot more public health measures on Saskatchewan people, even those that have done the right thing.
The SHA says there's literally no plan in place to return all these services that have been cut in healthcare. How can people feel optimistic about that?
I haven't heard the SHA say that there's no plan in place, and I don't know for what period of time, if that was said. Sorry, pardon me?
We don't know either. For
yeah, but did they say that?
They said it at the last PEOC.
Who said that?
I think it was either Derek Miller or Scott Livingstone. It was an official within the...
I'd have to ask. I don't know what the immediate plan would be for bringing folks back, but I know there's been, through private procurement, for example, of some of the testing that is coming in, through looking at private procurement for some of the contact tracing. There's hundreds of people that have been redeployed to support the COVID initiative, but not necessarily to support right in the ICU departments themselves. And ultimately, as we're able to procure, private companies that can do the testing and do it quite adeptly and competently, that we'd be able to hopefully at some point in the near future, I don't know when, and I don't know what that plan would be, but be able to bring back some of those services. For example, some of the services that are available, some of the therapy services for children, for example, that are very much required. And this is the goal of the government. Ultimately, I'm sure it's the goal of the SHA. I haven't been briefed as to what that plan is, if there is one. But that's ultimately the goal. I would say I don't know if there's a plan in place, but there is a goal that we would be able to return to those services as soon as we're able. Ultimately, what gets us to that goal sooner and quicker is for more people, yes, to go out and get vaccinated, but for our public health measures to continue to drive our infection rates down, which they are doing, which is a positive today.
Thanks, everyone.
Thanks.